we need an industrial revolution in health and healthcare in this country. I think the models we built are not the models for the future. We need to think about populations, not market share. We need to think about value, not volume. And we need to think about new payment models, not fee-for-service. They have real barriers. They're in a fee-for-service model. They've built a system based on paying people by how much they do. It's a very hard transition. And some people are afraid. They're really scared that what that's going to mean to their organization. And until we change the incentives and align things around the patient and the community we serve, we're not going to change the system. Our imagine is to create a sustainable health system for the communities and patients we represent for generations to come. Not because I'm here today and I want to make money for my hospital. If it's all about money, we've lost our way. We're often the largest employers in a community, in any space. The communities count on those jobs, and we're going to undermine that by reframing and recreating the health system, not healthcare system. To do that, we need to be cognizant of that economic impact on the environment in which we work, the ecosystem. I think the strategy needs to be very thoughtful, to not seem destructive to the current models or current systems, but rethinking the current systems and current models to create that new ecosystem, create new jobs in new ways that healthcare can be delivered in communities, not in hospital facilities. The notion that you need to engage the community, you need to have rules about how that's going to work with the community. You need to be transparent and have them involved in the decision-making process. And I think all of those actions that we're involved in with Rethink are parts of the way to move that forward, to create the community that creates the change, not the doctor or the system or the payer or the banking system. It's us as a community rethinking together how we create that future with good rules and regulations of how we'll do that we all want to play. What I also said to our board is that we can't continue to invest in the stock market. We need to invest in our communities. So as large health systems have investment portfolios, why shouldn't we be investing in a portfolio of our community, not in our bank account? And I convinced them to do that, and that's where the $3 million comes from. I don't know anybody else that's doing it, and it's not symbolic to me, it's what needs to be done. We need to invest in the communities and housing. We need to invest in food programs. When a system does not pay for the things we need, then the system should stand up and invest in those, because if we're really about population health and not about health care, that's where your investment should go. We're swimming upstream. We're going against a very strong current. The payment system doesn't work for what we want to do. People are happy in the way the system's working for them now. They don't realize the future's in jeopardy. We have a lot of work to do. And to not be cognizant of those difficulties will create the most difficulty for the health systems to actually want to change. So the community needs to be understood, but the doctors and the health systems need to be understood as well.